I'm incredibly proud to stand and speak in support of the Drugs, Poison and Controlled Substances Pill Testing Amendment Bill here today. It's, I think it's an incredible thing that we're doing. It's an incredible piece of legislation that we're bringing to the House, but more than a piece of legislation, it's something that's going to have such a real impact on people's lives, enabling Victorians to be able to test pills, providing a space for meaningful conversations about use, about the risks and how to minimise these with health professionals. This legislation will save lives. For me, it's also an incredibly personal issue. I lost my auntie when I was in my teens to an overdose. Growing up, I've seen a number of mates through a struggle with alcohol and then drugs, their mental health deteriorate, ending in suicide. To be able to have mature conversations about what we know is going on in community, what we know is resulting in the death of Victorians, as it is with the deaths of people around Australia, of people around the world, having this mature conversation is incredibly, incredibly important, and more than just the conversation, bringing it to legislation to enable Victorians to use these services is incredibly important. The trauma for loved ones and the knock-on effect that trauma has at losing a family member, a friend, a work colleague, someone around clubs, sports groups, various community organisations, the ripple effects from the 547 deaths that we had in Victoria in 2023 is immense. We are talking about this, what we are standing here debating today is not abstract or some sort of theoretical item that will sit on a shelf, a piece of legislation. This is really making incredibly meaningful difference in people's lives and will remove incredible amount of trauma. It will remove, for those that don't lose their life in overdose, for those that suffer that and who are fortunate enough to be saved, whether that's by bystanders who are trained and prepared or have access to equipment, which I'll go to later on, which we're making more available to save lives. But for those who survive, it's still incredibly traumatic, and obviously it takes the time of our frontline service responders. And I think that's another incredibly important part of this discussion here today. It's about listening to those frontline workers who turn up and respond, who themselves deal with those traumatic situations in trying to save lives, and obviously dealing with the consequence of those who can't, whether it's our ambulance workers turning up to that situation, our police going out to friends and families' doors and telling them what has happened and what has occurred. We can see the support, and I'll touch on this a little bit later in my contribution, but the 77 organisations connected with alcohol and other drugs that are supporting this, that have stood up and said, this is what we need for Victorians, this is what we need for our frontline service workers, again with alcohol, drug, our mental health workforce, workers who are represented by the Health and Community Services Union, HACSU. I know HACSU have absolutely passionately advocated for progress on this issue, and I want to make a point of acknowledging them and how they've pushed for change, how they have progressed the conversation, progressed the public conversation, progressed the conversation from that expert worker-led level, and it's an incredible thing that they have done. And I think when you compare that to the fearful tact that is taken by those opposite, when we're trying to talk about something that will save lives, that use of fear, that use of the other, of they, of demonising those that are using drugs. Like in this instance, we're talking about pills. We're talking about something that is at festivals, something that is, as was pointed out before, potentially other, whether it's race meets, whether it's whatever it is, this substance use is happening, and what we want to make sure is that individuals who are doing that can do so in a far safer way with a greater understanding of what's happening. Because when we talk about risks, when we talk about harm minimisation, we get better results. Ms Crozier was saying that, if I took her correctly, but basically was saying that there is no safe level of use, but then went on to talk about reducing deaths in cars. So under that theory, we would say no one can drive a car. There can be deaths in cars, so nobody should drive a car. But what we do is we educate people, we put safety provisions in place to reduce the harms. So, and talking, just coming back to the police, coming back to police, by stopping police having to go to doors and tell loved ones, family members that that loved one has just died, by having to present to the coroner, as I'll touch on soon, recommendations, I think 10 recommendations from the coroner for this, we are just, we're just reducing so much of that workload on frontline staff that doesn't need to be there if we don't have these deaths, if we don't have these overdoses. And so once passed, this bill will give the express legal authority for both mobile and fixed site services to operate in Victoria and support the government's commitment to introduce secure naloxone vending machines in key areas of need. And again, if people understand what, that these items are available, what it does, to have it on hand, to save a life, that's incredibly important. We're doing the same thing around defibrillation just in the hall today, or this week, sorry. We've got, CPR, getting people to practice CPR. I'm going to go and get my heart checked later in the week. Like this preventative, this harm minimisation, this understanding of what to do in these events is incredibly important. And just coming back to the point I made earlier, by those who are presenting to get their pill tested, having conversations that they are very unlikely to otherwise have. I think it's, and I'll come to it, something like 70% of those presenting in the ACT are having a conversation for the first time about something they never would have otherwise. And just broadly on that conversational level, I think we've done so much across society in recent decades of things that we would never have discussed, things that would never have been up for a conversation, whether it's mental health, whether it's the way people live their lives, whether it's alcohol, substance abuse, family violence, all these things that were taboo and off topic, we're bringing to the table so we can put some light on the situation. So people can identify and go, you know what, I'm human too, and I need some support in this situation, and I'll reach out for support, and because I can have the conversation, I can actually understand where those supports are and go and reach out to look after themselves, to get on with their lives, to live a meaningful, quality, healthy life. The trained peer workers and technical experts will also provide clients with, as I said, not only that pill test, but with that harm reduction information. And the pill tests themselves will enable us to identify when there are bad batches of drugs circulating in our communities. I remember hearing stories about this occurring over in Ireland, I think it was, being able to identify bad batches of drugs and getting the word out as quickly as possible to ensure that people are aware of what is happening and just stop these deaths from occurring. And I'll come to the jurisdictions shortly. But with the global drug market, there is increasing unpredictability in what is being sold to people. So it just reinforces the fact that it's never been more important for pill testing to be available to Victorians, and indeed, as we see over many jurisdictions around the world, to people to people who are able to access that. I've touched on the admissions to our health system and the incredible strain that adds, and workers' calls for and health experts' calls for this. But the 10 coronial investigations to reduce the number of preventable deaths and other harms associated with the use of illicit drugs. It's about, and I'll just come back to the opposition's comments earlier, it's not about telling people how to live their lives. It's about listening to experts, listening to community and working with community to get the best outcomes. And these, whether it's here in Australia or international experience, show that drug checking is an effective public health intervention. And it doesn't increase or encourage illicit drug use. It has proven its efficacy over many years with 31 programs operating globally, including in the United Kingdom, North America, New Zealand, and as I said before, here in Australia and the ACT and Queensland. So I think it's clear that pill testing is what we need, and it works, and it's just about how we best implement this service. So we're going to have an 18-month implementation trial from December 2024 to June 2026, and that will comprise of both mobile and fixed site service, and it will help us best understand the best ongoing model for Victoria. It will commence this summer and attend 10 events over the trial period, and then mid-next year the trial will see the establishment of a fixed site in central Melbourne, close to nightlife precincts and public transport. So it was pointed out by other contributions earlier, pill testing is also known as drug checking, and involves the chemical analysis of illicit or unknown substances to inform individuals of what they plan to consume. The client may receive information about the chemical compounds detected, including information about its purity. And we know that purity is an issue because people are taking pills that they think are one thing and have, whether it's other substances or higher levels, which is leading to overdoses. So they'll know the effects of compounds within, if there are multiple compounds, how they interact each other, and any unknown or inconclusive compounds that are found. And it will discuss the effects of the different dosages of the pills that are presented and how they will interact with prescription medication or alcohol, and what this will do, more broadly within people's lives. No one's told the drugs are pure. No one is told the drugs are 100% safe. The importance of this health intervention cannot be overstated. So, Acting President, I'm going to run out of time shortly. I just want to reinforce how absolutely proud I am that this legislation is here in the Parliament. I want to acknowledge Minister Stitt and the Premier for the incredible leadership shown to bring this to the Parliament, to deliver this for the community, for those within this place that are supporting and who've been long-term advocates, as have so many organisations, unions and workers around Victoria. And I think the thing that we can all be incredibly proud of is the fact that this legislation will save lives, reduce harm, and it will remove an incredible amount of trauma out of Victoria. Thank you, President.